Thank you, Drs. Collins and Nicholas, for those remarks and for your leadership. Colleagues, good morning. It is with great honor and privilege that I have the opportunity to serve as your next president of the Ontario Medical Association. I'd like to begin my address by expressing my very deep gratitude to my fellow doctors. You have spent every waking minute caring for patients during this pandemic. Thank you for everything that you do on a daily and nightly basis. And thank you for placing your trust in me to lead our organization. To Dr. Samantha Hill, your leadership as president this past year has been a master class in dedication, commitment, and grace. Doctors across the province owe you a debt of gratitude. To Mr. Odette, our CEO, OMA staff, our senior management, and our board of directors, your effort this past year has been remarkable. On behalf of our profession, thank you. Finally, I'd like to thank my family, including my parents, my sister, and my wife. I wouldn't be here without your incredible love and support. 15 months ago, our lives changed. A novel disease threatened our well-being, and doctors sprung into action. And you did this while caring for sick patients in growing numbers. You did this amidst PPE shortages. You did this despite online threats and harassment. You did this because this is what training and expertise looks like. You did this to protect all of us. As this crisis grew, so did the ingenuity of doctors. You reorganized our entire healthcare system practically overnight. Operating rooms, hospital wards, and physiotherapy gyms were converted into COVID units. You rapidly converted your practices so you were able to continue to deliver excellent care to your patients virtually. You led our province's response while also experiencing personal challenges. 3 bruising waves mirrored the waves of variants and community and procedural care shutdowns, which have resulted in a growing backlog of necessary care. Doctors were taking it on the chin while helping all of us keep our heads above water. While the initial hallmarks of this pandemic included concern, uncertainty, and loss, more than a year later, now armed with the vaccines, doctors have been rolling up their sleeves to put those vaccines into arms. From pop-ups at schools, arenas, and parks, to mass vaccination at malls, city hall, and community centers, doctors are once again at the center of this incredible civic work. It is this grassroots spirit that makes me proud to stand shoulder to shoulder with you. Through the hundreds of conversations that I've had with doctors across Ontario this past year, whether in the hospital or in clinic, during our vaccination drives or over Zoom, I have been inspired by your advocacy, your work, and your sacrifice. Through it all, you have shown all of Ontario what can be accomplished through collaboration, compassion, and courage. These are the key principles, the 3 C's, that will underpin my work during my term as president. And I plan to deploy these principles in the service of 3 priority areas. The first and most important is member advocacy. I strongly believe that the OMA exists to serve the interests of its physician members. This is the fundamental raison d'être for our organization, and it is leadership's responsibility to drive value for members. And I believe that this can happen when physicians are united. Members have told us in no uncertain terms that their main concern is negotiations. I can tell you, we hear you loud and clear. This understanding guides our current work during bargaining and remains a central focus for me and OMA leadership. Member advocacy also means that we continue to focus our efforts to support physician wellness. This pandemic has highlighted what all of us physicians have known for some time. Burnout is an epidemic that needs to be addressed at a systemic level, and you cannot have healthy communities without a healthy physician workforce. This pandemic has also exposed the harsh inequities faced by diverse communities across the province. The inspiring advocacy by so many physicians has created a blueprint for the OMA as we continue applying the lens of diversity, equity, and inclusion to our work. My second priority as president is engagement with health system partners. As physicians, we know that healthcare is a team sport. And as the quarterbacks for our patients' care, I believe we have the tools, experience, and expertise to innovate and solve our biggest healthcare challenges. In order for our system to be successful in its transformation for the future, I believe physicians need to be at the center of that change. The pandemic has shown just how valuable physician expertise is to every facet of our society. It is clear that there is no effective healthcare system without physicians, and we need to leverage our capacity to influence and affect change. That there will be a provincial election next year, I believe, presents a perfect opportunity for us to elevate the physician voice and interest. I intend to do just that, and I am excited to convene and engage with government officials, healthcare organizations, institutions, and leaders in the world of commerce, academia, science, and technology on behalf of our profession. The last priority during my term is OMA modernization. Over the past several years, membership and grassroots leaders embarked upon a journey of governance transformation for our organization. This year, we will begin to implement that change with a new board of directors, a new general assembly, and a new structure for our members to engage with the OMA. Now, this process of reform is a work in progress. The heavy lifting to get to this point will have to continue in order to ensure that we move forward to make the OMA an even more transparent, accountable, and effective organization for our physicians. Our success will be governed by how we demonstrate value to our frontline doctors. And I look forward to being part of that change and leaning on and empowering your voice and your leadership to help us achieve success. We can't do this without you. As a physiatrist, my expertise is focused on helping some of the most marginalized patients recover after significant trauma, injury, or illness. As we collectively begin to turn the page towards ending this pandemic, our society, economy, and healthcare system will be in great need of rehabilitation. I know that this will require time, investment, and expertise. I also know that Ontario's doctors will be leading the charge to help us all build back better. And speaking of building, 5 years ago, I was inspired to get involved in the OMA because of grassroots physician leaders like Dr. Zalam and Gandhi. They redefined the concept of advocacy for physicians by physicians. It is this ethos of unity and representation that motivates me to continue that important work. And I believe that our profession and the OMA succeeds when it commits to a big tent philosophy. The notion that we are stronger when standing together instead of apart. The idea that no matter what type of medicine you practice or where you practice, whether you are a solo community doctor or work in a tertiary academic center, whether you are close to retirement or still a learner, you belong here. You have a home here. You have an organization that has your back. That is my vision for the OMA, for our OMA. I am humbled by this opportunity to be your president. It is an honor and responsibility that I take very, very seriously. And it is my commitment to you over the next year to work my hardest every single day to serve you. Thank you for all that you do, and I look forward to working alongside you to make our organization a better one.